Some people are going blind when they stand up. Here's how this operation works. When you get a lack of blood flow, which we call ischemia, pieces of your brain might not work. When your blood pressure gets low, it tends to affect the posterior circulation, the vertebro-basilar system, and most often, 90-95% of the time, and maybe more, when you have a lack of blood flow in the posterior circulation, which is where it's affected when your blood pressure drops, you get a dysfunction of the brainstem. That's where most of the ischemia goes. And brainstem dysfunction typically manifests as dizziness, lightheadedness, nausea, and vertigo. So those are the most common symptoms. However, there's variability in that anatomy, and you can get most of the ischemia either below or above that level. If it goes a little bit higher, then you get ischemia in your occipital lobes, which is the part of your brain that sees, and so you become blind. If it's a little bit lower, it goes to the high cervical cord, and then you get paralysis. So you can get sudden onset of paralysis because of low blood pressure. When you stand up suddenly, these are people who are standing up and suddenly dropping blood pressure because of some autonomic dysfunction. So you can either become paralyzed or you become blind if it goes below or above the typical level. But dizziness is by far the most common presentation.